Hello everyone, welcome to today's session. If you are new to our channel, please subscribe it for the daily videos. So today, let me discuss about meninges. The meninges are the three membranes that envelop the brain and spinal cord and separate them from the walls of their bony cases, especially the skull and vertebral column. From the superficial to the deep, the meninges are the arachnoid mater. The cranial arachnoid mater is a spider web-like meningeal layer interposed between the dura and pia. The potential space between the arachnoid and dura is called the subdural space, and according to some authors, it contains a very thin layer of fluid. The space between the arachnoid and pia is called the subarachnoid space, and it is filled with the cerebrospinal fluid, that is CSF. Additionally, the cerebral arteries and veins are located in this space. And here, the second one is Pia Mater. The cranial Pia Mater is a highly vascular membrane that closely follows the contours of the brain. It does not lie on the surface of the brain directly, but rather is separated from it by a thin space called the subpial space, formed by the end feet of the astrocyte, that is glia limitans. Many superficial blood vessels of the brain are related to the Pia Mater. The function of the Pia Mater is to physically separate the neural tissue from the blood vessels in the subarachnoid. Here we have the last one, that is Dura Mater. It is also known as the Pachymeninges. The cranial Dura Mater is the outermost meningeal layer, which consisting of dense irregular connective tissue. It is composed of two layers. The superficial layer is the periosteal cranial dura. It overlies the inner surface of diplo, which acting like a periosteal layer of the cranium, and the meningeal cranial dura, which lies superficial to the arachnoid mater. And let me see what are the functions of this meninges. The function of the meninges is to protect the brain and spinal cord from the mechanical trauma, to support the blood vessels, and to form a continuous cavity through which the cerebrospinal fluid passes. And about the artery, the middle meningeal artery, meningeal branches of the ascending pharyngeal artery, accessory meningeal artery, branch of the anterior ethmoidal artery, and meningeal branches of the vertebral artery. And about nerve, the middle meningeal nerve and nervus spinosus. And let me discuss about what are the clinical relations. The first one is epidural bleeding. The epidural hemorrhage is a rare condition caused by the rupture of one of the meningeal vessels. The epidural bleeding usually occurs due to a fracture of the parieto-temporal region of the skull, which often causes a rupture of the before mentioned blood vessels. The next one, we have subdural bleeding. The subdural hemorrhage refers to the process of collecting blood within the subdural space between the dura and arachnoid mater. It usually caused by a traumatic injury to the heart and rupture of the bridging veins that connect the superficial veins of the brain within the dural venous sinuses. And finally, we have subarachnoid bleeding. Subarachnoid hemorrhage is the most common post-traumatic bleeding. Note that it can also be non-traumatic, related to the rupture of an intracranial aneurysm or any arterial malformations. The key symptoms of this condition is a sudden onset of a headache, which patients describes as the worst they have ever had in their life. Thank you all. See you on next day. Have a nice day.